You've definitely heard this term before, right? Flesh-eating bacteria. It's all over the news, sounds absolutely terrifying, and you know what? It's for good reason. It really captures the sheer speed and the destructive power of this thing. But what's actually happening behind that scary headline?
So the proper medical term is necrotizing soft tissue infection, or NSTI. And this definition is key. This isn't just any infection. The words to focus on are rapidly progressing and aggressive. It's an invasion that literally kills the tissue it infects. We're talking everything from your skin all the way down to the muscle.
So how on earth does something so devastating even start? Well, a lot of the time, it starts with something you might barely even notice. Let's take a look at the anatomy of this invasion and see how it goes from just a small cut to a full-blown crisis.
Okay, so on the left, you've got normal, healthy skin. You can see the layers all organized, a strong barrier protecting you. But on the right, well, that's the battlefield. The layers are swollen, blood vessels are dying off, and you can just see that the tissue is being absolutely destroyed from the inside out.
Everything starts with a single spark. Some bacteria find a way in. And get this, it doesn't have to be some huge dramatic wound. We're talking a simple cut, a bug bite, even a tiny little puncture. That's all it takes for them to sneak past the surface and get down into the deep tissue.
Once they're inside, that spark turns into a fire. The bacteria multiply and they start pumping out all these toxins. This just wrecks the cells lining your blood vessels, causing them to break down. Your body, of course, freaks out and launches this massive inflammatory counterattack. But here's the twist. That very response just adds more fuel to the fire, causing even more swelling and more damage.
And this right here is the absolutely crucial part. The infection doesn't stay put. It spreads like a wildfire along what are called the fascial planes. These are like connective tissue highways deep under your skin. The best analogy? It's like a fire spreading inside the walls of your house. You might only see a little scorch mark on the outside, but inside the whole structure is being destroyed. And that's exactly why these infections are so deceptive at first.
Now, not all these infections are created equal. We can basically sort them into two main types. Type 1 is actually the more common one. It's caused by a whole cocktail of different bacteria, and it tends to hit people who already have some other health issues. But type 2, that's the one you hear about in the headlines, the classic flesh-eating bacteria. It's caused by group A strep, and here's the really scary part. It can strike perfectly healthy adults, usually in an arm or a leg.
So that brings up a really important question. Who is most at risk? Well, certain conditions basically roll out the red carpet for this kind of invasion. Things like diabetes, alcoholism, obesity, or really any condition that weakens your immune system puts you at a much higher risk. And other factors, like IV drug use or just poor circulation, can create the perfect entry point and pathway for the infection to just tear through the body.
Okay, this brings us to what might be the most critical part of this whole explainer. How do you recognize this emergency? Remember, all that destruction is happening deep under the surface, so what are the red flags we need to be looking for on the outside?
If you remember only one single thing from this entire presentation, make it this. The number one most important early clue is pain that is completely, wildly out of proportion to what you can actually see. I mean, think about it. A small red area that looks like no big deal, but it's causing excruciating 10 out of 10 pain. That is a massive, flashing red light that something much more sinister is happening underneath.
Now, as the infection rages on, the skin will start to tell the story. It usually starts with just redness, what doctors call erythema. But unlike a simple infection, it changes, and fast. Soon you start to see what looks like deep bruising, that's ecchymosis, as those blood vessels get destroyed. Then you get these blisters, or bullae, often filled with this dark, nasty-looking fluid. And finally, necrosis. The skin itself starts turning black as it dies. This progression is a sign that the infection is winning the war.
And make no mistake, this is not just a local skin problem. The body is in an all-out war. That leads to signs of system-wide toxicity. You'll see a high fever and a racing heart, which is tachycardia. As the body slides into shock, blood pressure just plummets. The person might become delirious or confused, and there's a very specific, very ominous sign called crepitus. It's a crackling feeling under the skin, kind of like Rice Krispies, caused by gas the bacteria are producing. This is a 5-alarm fire for the entire body.
So a patient shows up with these terrifying symptoms. How do doctors figure out what's going on? The clock is absolutely ticking, so the diagnosis has to be fast.
Thankfully, we've got tools like ultrasound that let us peek into those deep tissues.
An image like this can show swelling, but the real smoking gun is finding subcutaneous air. You see those bright spots? Finding that gas under the skin is nearly a 100% specific sign that you're dealing with a gas-producing NSTI. It's a game changer for diagnosis.
So besides ultrasound, doctors have a whole toolkit. They'll run labs, which will show a sky-high white blood cell count and other inflammatory markers. A CT scan can give an even more detailed picture of what's happening. But at the end of the day, the one definitive test is grimly straightforward. You have to take the patient to the operating room and look at the tissue directly.
The second that NSTI is confirmed, or even just strongly suspected, it becomes a flat-out race. This isn't something you can wait on. This is a fight for life and limb, and it's measured in minutes and hours, not days.
The treatment stands on 3 absolutely critical pillars. First, and by far the most important, is emergency surgery to debride. That means to cut away every last bit of dead and infected tissue. This is non-negotiable. Second, you hit the body with powerful broad-spectrum IV antibiotics to fight the bacteria everywhere. And third, that patient is going to need aggressive, top-level supportive care in the ICU to manage things like shock and organ failure.
Yeah, this image really shows the stark reality of what that surgery looks like. It has to be aggressive. The surgeon has to keep cutting, removing all that necrotic, dead tissue until they finally get to healthy tissue that actually bleeds when you cut it. It's the only way to physically halt the infection's advance. And a lot of times patients need to go back for more surgeries, sometimes every day or two, until it's finally under control. So when a surgeon gets in there, what are they even looking for? Well, the signs are pretty unmistakable. You see, healthy fascia is supposed to be white and tough. But infected fascia, it's gray, it's dull, and when you cut it, it doesn't even bleed. Then there's this thin, grayish, really foul-smelling fluid that doctors call dishwater pus. It's as gross as it sounds. These are the grim signposts that tell the surgeon exactly how far the destruction has spread.
So, there you have it. We've seen how a tiny little break in the skin can unleash a devastating fire inside the body. We've talked about the subtle clues and the huge red flags. With a disease this aggressive, where every single hour counts, the biggest enemy isn't actually the bacteria, it's time. So the question I'll leave you with is this. After seeing all this, would you recognize the signs?